De marketing à la télé, et puis même toujours là. Mais nous, on est obligé de faire des conférences où on sort.
Hello everyone, am I audible?
Yes.
Yes, you are.
Yes, you are.
All right, greetings everyone. I welcome you all into today's session on hepatitis under Uniting for Global Health _. We'll first have a quick icebreaker session. For that, I'll hand over the session to Maham. Maham, please proceed.
Hi, everyone. My name is Maham, and I'm the National Public Health Officer of MSA-Pakistan. So firstly, on behalf of MSA-Pakistan, MSA Malawi, MSA Kenya, IFMSA Brazil, IMSA Iran, and AIM Burkina Faso, I would like to welcome each and every one of you to our session today on hepatitis awareness called Hepatitis Uniting for Global Health. So we have an amazing lineup of 10 speakers with us today. Each of them are from different countries and different animals. So they have their own unique experiences about hepatitis that they're going to be sharing with us today. What is the screening process for hepatitis in their countries? How are they dealing with it in their regions? And how and what is their own unique experience about hepatitis in their own regions? So before we get started, however, it would be great if we could have a very exciting ice-breaking session to kind of introduce ourselves and get to know each other. So I would really highly appreciate if each and every one of you could volunteer yourselves and introduce yourselves. Tell me your name, which country you are from, and if there is any skill in the world that you could learn, what skill would that be and why? So I'll start first. My name is Maham. I'm from Pakistan, and if I could learn any skill, I would love to learn to play the guitar. So that's it for me. And now, please, I would really like if any one of you could volunteer yourselves and introduce yourselves too. Thank you.
All right, I'll go next. I'm Minahal Bint Tariq, National Officer for Research Exchanges at Medical Students Association of Pakistan. So one skill I would like to have is command over other languages, including Korean and Spanish. I'll nominate someone else. I'll nominate Anas Ahmed. You can either use the mic or the chat box. Guys, it's a quick icebreaker, so I would like you guys to participate so that then we can officially start with our session. Anyone else wants to volunteer? Yeah, sure.
So, hello guys, my name is Gustavo. I'm from IFMSA Brazil. And I believe that I would very much like to learn another language as well. I think Arabic is very challenging for me. So yeah.
Perfect. Anyone else?
I can go next.
Yeah, sure.
Hello everyone. I'm Jaber. I'm from Morocco, and I'm currently IFMSA PCH and CDs. Again, I also would love to learn more languages, although like already speak some of Spanish, Arabic, French, and of course English. I would love to learn Portuguese for some reason. I also like wanted to visit Brazil for so long, so it would be like perfect for me to learn the language and then visit the country. But yeah, basically that's it. If someone else wants to go.
Anyone else?
Hi everyone. My name is Sylvian Chamwinja from Kenya, the National Officer for Public Health, MSAKE Kenya. And one skill I'd love to learn is to speak the languages from the Asian region, like Chinese, Korean, Japanese. I think that's something I'd really love to learn.
Okay, hi guys, I can go next. My name is Bahar Fazal, and the National Officer of Public Health in Iran. And one thing that I would like to learn is program writing and using AI and yes, artificial intelligence and these things. Okay, thanks.
Does anyone else want to go next? Again,
So
I would.
there are a few responses in the chat box as well from Dhanshuri. I'm sorry if I'm pronouncing your name wrong. And they're saying they're from India, and the one skill I would love to learn is to get children's attention when I'm teaching something. That's great. And then there's Mahnur Khan from Pakistan. She says she would love to learn cooking because she's a foodie person. So am I. Anyone else wants to go next?
Hi, everyone. My name is Jamila Sawadogo and I come from Burkina Faso. Thank you.
All right, I guess that's all. So Maham, you can introduce our speakers then.
All right, thank you everyone so much for making our ice-breaking session so successful. Now I would like to introduce our first amazing speaker for today. Our first speaker is Gustavo, who is the National Public Health Officer of IFMSA Brazil, and he will be talking about hepatitis in his country. So please welcome our first speaker. Over to you.
Hey guys, how are you? I'm going to share my screen. Okay, are you seeing?
Yes, it's visible.
Perfect. So hello, my name is Gustavo. I'm going to talk a little bit about the hepatitis, giving you an overview before we go for other speakers and talk more with depth in this subject. So this is me. My name is still Gustavo. I am the NPO of IFMSA Brazil for this year, and I'm also an IFMSA trainer. To give this overview, we will start with a quick one, and then we'll talk a little bit about how hepatitis is dealt by the healthcare, and then we'll go to basic epidemiology. So what is hepatitis? We can give a very broad definition that hepatitis is an inflammation of the liver. It's typically caused by virus, but other causes can make hepatitis. Like we have autoimmune diseases, we have alcohol consumption, toxins, medications. A lot of things can cause hepatitis, but the most common types are the viral ones. And these viral ones we can divide in 5 major categories depending on which virus is causing it. So we have hepatitis A and E, which is caused by 2 different viruses, but both are passed through the same infection routes, that is fecal oral consumption. We also have hepatitis B, C, and D that are transmitted by the exchange of fluids between healthy people and infected people. The goal of today is to talk a little bit about hepatitis, what we can do to fight it. Treatment is usually best done early, and we have antiviral that usually deal very well with the disease. It is not common for hepatitis A or E to chronify, but hepatitis B, C, and D can, and it gives the healthcare even more weight for this disease. In complications, we have a lot of complications in hepatitis. If left unchecked, it will cause liver damage and may require a liver transfusion, a liver transplant. So it is a very serious disease. Prevention is the best way always. So we have vaccinations against hepatitis A and B, but also we need to think about more broad ways of prevention, like sanitation, using condoms in case of hepatitis B and D and C. Diagnosis is made by a lot of methods, and symptoms include a very broad and non-specific symptoms. We have like the early symptoms are very flu-like, so it's very hard to detect only by the symptoms. But as the disease has its course, it becomes more defined by liver symptoms. So loss of appetite, you start to have a yellow skin, so it becomes more apparent. And our goal for today is to fight hepatitis and help to end it in our world. So we'll talk a little bit about how to prevent it, how to correctly fight it, how we as medical students can fight it. So very excited for today. Talking a little bit about hepatitis in healthcare. So in Brazil, hepatitis alone, if you treat the infection by the hepatitis B virus, you will have a $200 cost. So this is very important because in Brazil we have an universal healthcare. So in theory, all costs are covered by the state. So if all costs are covered by the state, in Brazil, we expend about $200 for treating a person with HPV. So of course, it's really expensive if you think about all the numbers. We'll talk a little bit about epidemiology. But it is still less expensive if you think about complications. So if you have cirrhosis, you will have a cost of $4,000 to treat the patient, which is way more expensive, 5 times more expensive. And if you go to a liver transplant, that is the last resource. So all therapeutic strategies are over and you have to do a liver transplant, about $20,000 are necessary to treat this patient. So it's really expensive. And if left unchecked, it becomes more expensive for the healthcare. In case of strategy, that's why we need to prevent first, because prevention is way cheaper than $200 for people. Early diagnosis will avoid this cost to evolve, like for HPV, going to cirrhosis, going to liver transplant, and a consistent treatment. So many people don't understand the necessity for treating HPV because they are asymptomatic, because they don't understand the chronification process. It's really similar to HIV because many people only see it as acute disease and don't understand that if left unchecked, it will evolve and it will cause chronic problems. And the most challenges are related to literacy in health. So people don't understand the necessity to treat hepatitis chronically, and they don't take the medications correctly. They do take it every day. They left some days without taking, and this causes the disease to become more apparent again and cause more symptoms. Also, comorbidities is a really important topic because usually hepatitis come with hepatitis B, C, and D comes with other ESTs. So we have hepatitis, and we have HIV, and we have syphilis. So the person is already taking a lot of medication, and they can be like, oh, I'm already taking medication for syphilis. I'm not taking another medication for a problem that I won't have until some 20, 30 years. So these are the main issues. Give a quick overview about epidemiology. So now there is a prevalence around more than 300 million people in the world have hepatitis B or C. It's really hard to quantize, to put in numbers. Hepatitis A, E, and A and E and D, because they are not as studied as B and C, because B and C have the higher chance of chronification. The incidence numbers are unfortunately really sad. We have about 2.2 million new cases in 2022, and around 1.3 million in deaths in 2022. So even if we as a global community of doctors and healthcare agents, we still have to fight hepatitis because it is still a prevalent and a very high, with a very high rate of incidency disease. So here's the main transmission routes that will help you understand a little bit about these 5 types of hepatitis. We have fecal and oral route for hepatitis A and D. So we're talking about sanitation problems. We're talking about transmission by infected food or water. And in the case of hepatitis B, C, and D, we have the transmission by infected body fluids like blood, saliva, vaginal fluids, and semen. It's really important to note that hepatitis D, it's a co-virus, so she only infects people with hepatitis B. So the virus for hepatitis D, it has a specific enzyme that only can attach to the cell if connected by the HBV virus. So it's a co-virus. The main risk factors for these 3 viruses, B, C, and D, are multiple partners. So having a very active sexual life and not using protection. Needle sharing. So mostly drug use is related to this needle sharing and risk for hepatitis. Unprotected sex, sharing hygiene items like razors, unsterile equipments, mostly in tattoos, but any kind of medical context, we can have this unsterile equipment transmitting hepatitis, but we usually talk about tattoos. Contact with open wounds, and this is more like a risk for the professionals in health. So when we are treating an open wound, trying to stitch it, and then we have an accident, that's also a risk. Mother's infection, because this virus can pass through the placenta. Hemodialysis, because it's a very invasive process and can sometimes have some unsterile equipment involved. And being an inmate. So inmates are exposed to a lot of ESTs because of unprotected sex, sharing of personal items. So it's really a risky situation for hepatitis B, C, and D. For A and D, we have more simple terms. We have the inadequate sanitation, so don't have a basic sanitation, and people infected with hepatitis A and D will defecate in drinking water, or this water will eventually go to drinking water and will infect another person. Also oral and anal sex, because we have the direct contact between a soft tissue with infected fluids, that is anti-anal region, and of course unsafe water and food consumption. Here is some quick numbers about hepatitis A, B, C, and D, and E. We can see that we have a higher concentration of hepatitis A in Africa and India, with the Eastern Mediterranean region with a little bit of color, and also Latin America. Hepatitis B follows a little bit a different pattern because we have different routes of transmission. So yes, we have a higher concentration in Africa, but we also have higher concentration in other countries like Southeast Asia, China, and some Latin American countries. For hepatitis C, it follows a little bit the hepatitis B distribution. It's a little bit different because of local epidemiology, but it's just a question of what virus was already prevalent in a region or another. Hepatitis D is more rare, more strict, because it needs, as I told you, it needs to have the hepatitis B virus already infecting the people. And this is hepatitis E distribution. It follows a lot the distribution for hepatitis A, because it is also the same route of transmission. And this is my topic. Hope you got something out of it. I would like to invite you all to participate in Scope Week. We'll talk about this topic and a lot more about public health. to happen in Brazil this year, São Paulo. It would be really good if you could come.
All right, thank you so much for the session and for your time. Now I would like to introduce our next speaker, Jaber from Morocco, IFMSA Program Coordinator for NCDs. Over to you, Jaber.
Yes, thank you so much. I would like to share my screen. So after like taking the screenshot and of course contacting Gustavo for the Scope week, which is gonna be like in Brazil, and it's gonna be such a great opportunity for you guys to learn about public health, but also like attend different trainings and so on. And it's gonna be like just fun because there is lots of like students from all over the world that's gonna be there. So yeah, definitely join. So yeah, I'm gonna share my screen. And okay, there is like notifications that come. I just need to, okay. So hope you see my screen.
Yes, it's
Okay, you
visible.
can see my screen. Okay, perfect. So yeah, hi guys, I'm Jaber. I'm IFMSA Program Coordinator for Health, Lifestyles, and Communicable Diseases. And I will be talking about types of hepatitis and their impact, and a bit more about the international issue, and a bit more I'm going to talk about the role of youth and medical students specifically to combat or to address this issue. So Gustavo already talked a lot about the types of share my screen again. Okay, you can hear me now?
Yes, you're audible.
Okay, perfect. So as I said, Gustavo already explained how there are two types of hepatitis. There is the viral one and there is the non-viral one. And he also explained that the viral one is the very most common, I would say, type of hepatitis in the world. So today I'm going to talk a bit about the different viruses that are responsible for the hepatitis, I mean the viral hepatitis. And I'm going to most likely focus on the elements that we need to know as medical students or as youth in general to act on that on this topic and to address it. So the main thing that I would love you to know is the chronicity rate. So here you can clearly see that there is only three viruses that can lead to chronicity. So there is the type B, the C, and the D. Compared to the A and the E that are not really, lead into chronicity, and they are more acute infections. So, and of course, the chronicity is within like the 6 months, like the duration is to determine if it's chronic or not is 6 months. So if it's shorter than 6 months, it's acute. If it's more, then it's chronic. So the chronicity is important to know because it's these three viruses that lead to chronicity are the ones that can lead to cancer, to liver cancer, compared to the A and the E that don't really lead to cancer because they are acute. Now, the routes of transmission, Gustavo already explained that. So there is the B, the C, and the D that basically are grouped, and they are all basically transmitted either sexually or bloodborne or perinatal, which we call also like mother to child transmission. And there is also the A and the E that are mostly transmitted by contact with body fluids. It can be contaminated water, it can be contaminated food, or just like a person-to-person contact. Now, a very, very, very important section of this table is the vaccine and the treatment, because if we know which viruses have vaccine, we can promote these vaccines and we can prevent the development of the viruses within our communities. So the A has a vaccine, which is good. It doesn't have like a treatment, but it has a vaccine. So we need to focus more on primary prevention. For the B, it has a vaccine, and the treatment, if like the patient is already sick with the disease and already diagnosed, then there is a lifelong treatment. For the C, there is no vaccine, but there is an available treatment that actually cured the patient. So it's not a lifelong treatment, but it's a short-term I would say treatment that actually results to the cure of the patient. And then there is the D, as you already know, the D is in most cases associated to the B. So not in most cases, like in all cases, is associated to the D. So we always use the vaccine of the B virus, and of course the treatment is also the same. And the E, there is no treatment, but there is a vaccine. And even like this vaccine, we don't really consider it as present because it's only present in China, and I believe also in Japan and some very fewer countries. So it's not really available in most countries in the world. So we don't really consider it as a actual vaccine or treatment because it's not really present in all countries. So here's like a very, I would say, simple way to remember this. So the B, the C, and the D are usually associated when it comes to transmission. And also like the chronicity and them lead into like chronic diseases like organ failure, cirrhosis, and of course liver cancer. And then there is the A and the E that are usually like also grouped, and they are more, I would say, acute and so on. So here is a very I keep losing you guys. Can someone please confirm if you can hear me?
Yes,
Yes.
we can.
We can hear you.
Okay, I'm gonna close my camera so that I don't lose you again. So so yeah, then there is the hepatitis C that is usually asymptomatic, but it can lead to chronic fatigue and depression, and it can also lead to like cirrhosis and liver cancer. So a very beautiful thing that you need to know here is that it's usually not directly, we don't really go directly to symptoms. So first of all, there is an asymptomatic phase. It's usually around 4 to 5 weeks. And then there is a pre-jaundice phase, and then there is a jaundice phase. So it's usually not all patients that you're gonna meet have all these symptoms. So some of them are in a more, I would say, like a more, I don't know how to say it, but it's like in a more, like an earlier phase of the disease. So you won't really see all of these symptoms. Now, this one, I want to share with you how the B virus and the C virus are the most common causes of liver cirrhosis and cancer. So although I would say hepatitis is a communicable disease, it's most likely, it's in most cases caused by a viral transmission. It is also good to know that it can lead to cancer and cirrhosis and organ failure, which is non-communicable at the end. And when we say about like chronic and non-communicable diseases, we also mean long-term treatment. It also needs like the rise of the cost of the treatment. We can also it also means that it has effects on the psychologically and socially, but also effects on the relatives, because most patients require psychological support, but also like social support and as much as they need the medical support. So now I'm going to talk about some international efforts to combat hepatitis. I'm going to start with the World Health Organization. So it's good to know that there is a whole department that is focusing on this specific topic. This means that the hepatitis is actually considered internationally as a burden, as like a public health burden that required a whole department, a WHO department to actually work on it. So there is the WHO department it's the WHO Global HIV, viral hepatitis, and sexual transmitted infections that work on this topic with other STIs. So they conduct different campaigns in different periods of the year, and they have a lot of infographics. I really invite you to go look it up because it's very important. So then there is the guidelines that they have created, and there is a whole document that was done in 2022 that you can definitely consult for more information and guidelines done by the World Health Organization for this specific HIV. So they focus more in the sexual transmission and as we know, like the B and the C and the D, they are the ones that are mostly transmitted that way. But yeah. And then there is the Global Hepatitis Program. So I talked about the department, the Global HIV, Hepatitis, and sexually transmitted infections. But they have within this program within this department a specific program about the global hepatitis, and they have shared very recently the Global Hepatitis Report 2024 that you can also consult. They have lots of graphics and a lot of like epidemiological data that you can use in your campaigns if you want and so on. So, and lastly, within WHO, there is also a resolution that was done in the 75th World Health Assembly. Its name is the Global Health Sector Strategies on respective So when you see that there is a complete resolution that was presented in the World Health Organization or like the World Health Assemblies, you know that the topic is very important, and it's created a burden enough for WHO and member states to actually act on it and create resolutions to address the issue. Now, here are some other international organizations that also work on the hepatitis. There are multiple others. When I searched, I found more than 20 organizations, international organizations that work on this specific topic. But I mentioned these because they are the ones that are more, I would say, most known. And they do a lot of campaigns, a lot of work, a lot of webinars constantly. So I'm sharing with you these names for you to, consult their websites and see if they are organizing anything and get some inspirations for your campaigns in your countries. So there is the World Health Organization, of course. I've already shared some of their, work. There is also the World Hepatitis Alliance. There is the Centers for Disease Control and Prevention. There is the Hepatitis B Foundation, and there is the European Association for the Study of the Liver. And I said there are multiple others that work on this. So if you really want to conduct a campaign in your country, you definitely need to look for these organizations and get as many inspirations as you want. Now, without any delay, I will jump straight to the role of youth in addressing this issue. Youth is a huge demographic in the world. Like we represent like millions of people in the world, and our role as youth is very important because of our energy, motivation, diversity, and mostly new ideas to address these issues, and the way we use technology to our advantage to spread the word and organize bigger and bigger campaigns, which is very, very important as well. So here are some very main action points I would say that I usually share with members in general in my sessions. And these are the 5 main action points that I see youth can work on to either raise awareness on a certain topic, but also promote it and so on. So the first part is prevention, is focus on prevention. You can also promote the vaccines. You can also promote the early signs so they can get treated early on. You can also raise awareness and education. You can educate your members in your community. You can go to some associations or some departments within hospitals and clinics. You can go to schools and raise awareness there and educate people in general on this topic. There is also advocacy that you can do through either in-person campaigns or social media campaigns, and they are both effective. There is the research part of it, meaning either through creating policy documents or conducting research to create educational material that you're going to be sharing in your campaigns. And there is also patient support, which is very, very important by organizing, I would say, someday going to some hospital department and supporting those patients either psychologically or socially to some extent, but also go to patients that have already been like maybe cured by the disease, either with the type A or E or some of the type C, and then like ask them about their experiences and how it was and what were their early signs and so on and so on. It's also a good way for them to share with you their stories and so on. So here are some ideas that you can definitely implement in your communities to raise awareness, promote, but also support your patients and your community in this particular topic. So I'm done. I try to be as fast as possible. So please, if you have, so we can like be on time still. So if you have any questions or anything, please raise your hand. We have like 2 minutes before I pass to the next speaker. Okay, then. So I think we can just move on to the next speaker. And
Thank you so much, Jaber, for your time and for this session.
you're welcome.
Also, I would like to ask or request everyone to please open up their cameras for a quick picture. Right. Anyone who is on laptop can click the picture after giving the countdown from 3. Who's doing it? First lady.
All right, my lady screenshots.
Thank you. Moving on to the next speaker. Maham, please, the next speaker.
Okay, thank you so much for that session and for your time, Jaber. I would like to introduce our next speaker, Dakit C. Haruna, who is IFMSA Program Coordinator for Communicable Diseases. So please welcome our next speaker. Thank you.
I think so. He's not in the meeting.
Yeah.
We can move on to the next speaker. Just a second. Meanwhile, we'll move on to the next speaker. If he joins later, he can deliver his session. So the next speaker is Joanna, NPO IFMSA Serbia. Go to you, Joanna.
Hello, everyone. My name is Jovana. I am National Public Health Officer of IFMSA Serbia. Colleagues before me said the most important things related to hepatitis. In order not to repeat the same things, I will focus on covering hepatitis perspective, national strategies, and prevalence here in Serbia. This year, World Hepatitis Day is also celebrated in Serbia under the slogan, "It's time for action," in order to highlight the need for joint action to improve access to the diagnosis and treatment of this disease. In the most cities, our citizens can be tested for hepatitis for free until the end of August at health centers and public health institutes. According to the estimates of health experts, about 70,000 people are infected in Serbia, but there is a lack of accurate and comprehensive data. Epidemiological data in the Republic of Serbia are in 2023 a total 392 cases of hepatitis were reported. This is the result of better record enabled testing and early diagnosis, which leads to a better treatment outcome in the disease detected on time. During the same year, hepatitis viral chronica C was registered in 190 people. This is about 3 people per 100,000 inhibitions. In the same year, there were 5 reported deaths in our community. Since the beginning of this year, 2024, a total of 253 cases of hepatitis B and C have been reported. The most frequently reported cases are, just as I mentioned before, hepatitis viralis chronica C. The total number is 98 cases, followed by reported cases of hepatitis viralis acute B. One death has been recorded since the beginning of this year. Twice as many men are registered, and the highest risk in both sexes is registered in the period between age 30 to 48. Hepatitis is an insidious disease that has no specific symptoms. It can be detected in the early stages only by testing. So it's recommended in our country that every adult has to be tested for hepatitis B and C at least once in their life. In our country, the Ministry of Health is working to increase the availability of hepatitis B testing and to adopt the national program for the prevention and treatment of hepatitis B by the end of this summer. Thanks to the implementation of vaccination against hepatitis B, which has been carried out in our country since 1989 by vaccinating certain categories of the population at specific risk, as well as vaccination of the children in the first year of life and 12 years of age, which has been carried out since 2006. The number of people infected with hepatitis B in the territory of Belgrade decreased year by year. It's really important to promote importance of prevention, testing, and treatment of viral hepatitis B and C. It's important to increase the access to testing in the community and health institutions, reduce the stigma and discrimination patients faced by hepatitis. We should educate our community, civil society, encourage them to participate in prevention programs. And in my standing committee for public health as medical students, we are trying to educate our citizens in our 5 cities. We organize during the whole year activities dedicated to public health with the accent on hepatitis. That's it all from me.
Thank you so much, Joanna, for that presentation and for your time. Yes, I would now like to our next speaker, Dr. Christopher Haruna, who is IFMSA Program Coordinator for Communicable Diseases, to please share their session. Thank you so much. Yes, Dr. You can share your presentation. Hello, am I audible?
You are audible. Can move to the next speaker for the time being.
Okay, so we'll go to our next speaker. I would like to present our next amazing speaker, Bahar Fazil, who is the National Public Health Officer of IMSA Iran, to please share her presentation. Thank you.
Okay, yes. Can you hear me now? Okay. Hi, everyone. Hi, all health enthusiasts all around the world. My name is Bahar Fazil, and a fifth-year medical student from IMSA Iran. Thank you for joining us today. We are thrilled to have you here, and I'm so proud to represent Iran's statistics and strategies regarding hepatitis to you. Okay, as we know, hepatitis encompasses a range of viral infections that can lead to serious health complications. In Iran, the government and health system have made strides in addressing this challenge, but there are still hurdles to overcome. According to WHO, an estimated 3% of the Iranian population is living with chronic hepatitis B, while approximately 0.7% are affected by hepatitis C. And these figures highlight the importance of targeted public health strategies. And the Iranian government has recognized hepatitis as a priority health issue. In recent years, efforts have been made to improve screening, diagnosis, and treatment accessibility. The National Hepatitis Control Program was established aiming to reduce the prevalence of these infections and enhance overall community health. The first step taken to control hepatitis B was the vaccination of newborns, started in 1993, and it can be said that now approximately of 100% of newborns are getting vaccine at birth for free. And also the Ministry of Health has started a 10-year national program to eliminate the hepatitis B. For this purpose, screening and diagnosis of hepatitis was integrated into a health system network, and regarding the treatment, and now more than 10,000 patients with hepatitis C who are in 5 vulnerable groups, like prisoners and drug users and low socioeconomic groups, are getting treatment. But the target is to reaching 20,000 treatments per year. According to other strategies done in Iran, we can say Iran has initiated community outreach programs that involve mobile health units to provide screening in remote and undeserved areas. These units not only offer testing for hepatitis, but also educate community about liver health and prevention strategies. Specific programs have been developed to target high-risk groups, including people who inject drugs, prisoners, and those with a history of blood transfusion before 1995. These targeted efforts aim to identify undiagnosed cases and link individuals to care. The Iranian healthcare system is increasingly integrating hepatitis services into primary healthcare settings. This approach allows for more comprehensive care, where general practitioners can screen for hepatitis during routine health checks, and thereby normalizing testing and also reducing stigma. Training programs for primary healthcare providers have been established to ensure they are equipped to manage hepatitis cases effectively from diagnosis to treatment. Also, Iran has updated its national treatment guidelines based on the latest global standards. And these guidelines ensure that patients receive the most effective antiviral therapies available, including direct acting antiviral for hepatitis C patients, which have shown high cure rates. Okay. And the government also worked to negotiate lower prices for these medications, making them more accessible to patients across the country. Despite all these efforts, several challenges remain. For example, the one challenge is that the stigma and awareness. There is a significant stigma associated with hepatitis, particularly hepatitis C. Which is often linked to drug use and other high-risk behaviors. And this stigma can deter individuals from seeking testing and treatment. And also, there is some challenges about access to healthcare. While urban areas may have better access to healthcare facilities, rural communities often face significant barriers, limited resources, lack of trained personnel, and an inadequate infrastructure hinder effective hepatitis management in these regions. Also, some challenges are in screening and diagnosis. Many individuals remain undiagnosed due to insufficient screening programs. Increasing awareness about the importance of regular testing is crucial for early detection and treatment. It is estimated that only 35% of the hepatitis C patients and only 8% of hepatitis B patients have been diagnosed so far. That is so low, and we can improve our screening strategies. Also, there are some treatment accessibility challenges in Iran, and according to all of these efforts, along with whole world, we are trying to eliminate hepatitis 2. We can work toward a future where hepatitis is no longer a significant public health threat in the world. So let's gather together and make a change. Thank you for listening.
Thank you so much for the session. Now I would like to Bahar session. I forgot your name, that's why I couldn't say it. Also, I would like to call upon the next speaker. That is Dr. Paul. He's an intern doctor at Queen Elizabeth Central Hospital in Malawi. Over to you, Paul.
Thank you. Can you see my screen?
Yes, it's visible.
All right, so my name is Paul. I'm a doctor here in Malawi. At one of the central hospitals we have here, and I'm going to talk about hepatitis in my country. So Malawi is one of the countries in sub-Saharan Africa. If you look at my tiny map at the corner, you notice it's somewhere in between Zambia, Tanzania, and Mozambique. It's in a very obscure part of the country, not very well known. The main conditions we deal with are infectious diseases, HIV, malaria, things like that, including hepatitis. So hepatitis, in terms of its prevalence in our country, is about 8.1% for hepatitis B and 7.3% in terms of the prevalence for hepatitis C. We don't really have enough studies to estimate how much hepatitis A, D, and E, and so on. So that's kind of one of the problems we have. We don't have adequate data on such things, but and the data is kind of old because the studies that I had to get this data from was from about 2016 or so. so we don't really have adequate data on it. But at least according to our previous studies, it is around 8.1% for hepatitis B. So hepatitis B has shown to cause about 75% of the liver cancer cases in the country, and hepatitis C causes about 3%. So it has quite a high case for action because of the morbidity that it has presented, especially on the oncology part. So the government is pretty committed to eradicating hepatitis. One of our goals is to eradicate hepatitis by 2030, which is possible with if we put enough resources together. Like HIV was a pretty huge epidemic, but we're able to put it in control over some 20 or so years. And I think hepatitis, if we were able to pull enough resources, it's possible to eradicate it by around 2030. Another thing that has been done here, which is to help eradicate hepatitis, is that we now have a clinical management framework. We have a whole guideline on how to deal with hepatitis. So it runs from 2023 to around 2027, and it's updated every 4 years or so. And that's kind of to help everyone, even in the rural areas, to know how to deal with the hepatitis if they meet it in any particular way. Another thing that's being done is various research and studies on hepatitis, but they're not very extensive, and it's not really enough at the moment. So that really needs to be put up, I guess. So one of the questions I had is, are things kind of getting better? The answer is, well, sort of. According to my experience, one of the tests that women have to come with in the hospital as part of the antenatal care is a hepatitis B test. So hepatitis B, and I think hepatitis C as well, they have to come in with those tests. We've seen an increase in how many patients come in with hepatitis B tests, like already done. Most of the time we have to do them at the central hospital, but these days we've been able to, a lot of patients come in with those tests already done. So that's kind of an improvement for us. It's not enough at the moment, but it's sort of getting better. We don't really have that much we're not really ahead in terms of vaccines and so on, but one of the things that is at least significant is that mothers are at the moment getting tested while in antenatal care. Some of the challenges we have at the moment in terms of dealing with hepatitis is, first of all, inadequate knowledge of hepatitis, both for the common man and healthcare workers. It's been shown that there's like a lot of stigma around healthcare around hepatitis. Actually, there's a recent study showed that there's higher stigma around hepatitis than there is around HIV. So people don't really know enough about hepatitis. At least healthcare workers don't know enough about hepatitis. Well, the common man or normal people, quote unquote, don't really know what even what hepatitis is. So we kind of need to work on that. On the other hand, we also don't have enough data on hepatitis. We have pretty old research, as I already explained before, and the research is not really extensive enough. There have been some studies recently which have shown that we have a bunch of undiagnosed cases of hepatitis in the really rural areas. And the study was done in one of our districts, and they showed that a really large number of people had hepatitis, but we've not been able to diagnose it. And part of the reason is, reason number 3 on my screen, which is inadequate resources, primarily testing kits. One of the reasons is that we don't really have enough resources to push so much towards hepatitis. We have a lot of other things we're already dealing with, and to add hepatitis is already a priority, but to give it the necessary care it deserves is very difficult. So we don't really have enough we don't really have enough resources for that. And that's a pretty big challenge for us. So what could be the possible solutions for this? Of course, public awareness, things like World Hepatitis Week and things like that need to really be pushed forward in terms of how often we go around and how often we are able to go and do civic education and so on, to make sure that not just normal people know what hepatitis is and know how to prevent it, but even for healthcare workers, because not enough healthcare workers know that hepatitis even, they don't really have enough knowledge on hepatitis. So public awareness is pretty important, and civic education will go a really long way in dealing with hepatitis. It will also be able to pull the eyes of the government to make it more of a priority than it has been. Another thing we could work on is prevention and vaccination. At the moment, as far as I know, medical students here get the hepatitis B vaccine before they go to their clinical years. That's pretty important. But most people in the, most normal people, most people in the local areas and so on, don't really know anything about how to prevent or how to get back, or if they don't even know that the vaccine exists. So that's something that I guess should be worked on. The third thing is, of course, funding. I put a question mark on funding because, well, everything needs funding. So to say funding is a solution to something is pretty generic. But as much as it is a generic solution, it is still important, and we do need quite a lot of money and a lot of resources, and we need to push a lot of resources towards towards hepatitis if we're really going to clean up, and if we're going to make sure that it's eradicated in about 6 years' time. So that's it from me. If anyone has questions, you can let me know. Thank you.
Yes, thank you so much. And you can introduce the next speaker now, Maham.
Thank you so much, Dr. Paul, for the amazing session. And thank you for your time. And I would like to introduce our next speaker, Luis, who is the NPO assistant of IMF Mexico. So the stage is yours.
Thank you so much. Hi, everyone. I'm sharing my screen, so give me 1 second. Do you see my screen?
Yes, we can.
Okay, thank you. Okay, hi everyone. I'm introduce myself. My name is Luis Rodriguez. I'm the NPO assistant from IMF Mexico here in Americas region. I'm very happy to be here with all of you, and I'm very thankful for all the OC to the invitation for participate in this important program and experience. So I'm very happy and grateful for all of you. So my participation is focused on diagnosis and testing of hepatitis. I'm trying to make you a resume for this team. It's very specific things and very consistent, and I'm try to explain myself better. If you have any question, put in the chat or something like that. But I'm trying to be a lot of specific. Okay, let's start. The first part is the screening and diagnostic test. all of we know that hepatitis is an inflammation of the liver that may be caused by viruses, alcohol, medications, and other diseases. Accurate detection and diagnosis are essential for effective treatment and prevention of transmission. The main detection tests include serological and molecular tests. Although the other speaker says a lot of important things, and in their countries, in a general or in a global focus for hepatitis, it's very important thing to be in mind, like a future doctors or medical students. It's a very it's a very important problem to that we can try to make better in the future. So if we are more specific, we have to test in the hepatitis, we have serological tests, and the other tests when I have more in the future, what is I have serological and molecular tests. So we can talk about the two tests. So I'll put you a little bit examples and focusing serological tests. The serological tests are essential for detecting the presence of specific antibodies in the blood, which indicates if a person has been exposed to the hepatitis virus and if they have developed an immune response. So this is the serological test more in the last of the exposition. We have a very important thing. For example, here in Mexico, this test is very expensive. So it's not access for all the people in my country, and only if you have the money to go to a private hospital, you don't have to pay with that, but the hospital is not too it's so expensive. But in the public case, we have something like this Secretaría de Salud or health secretary, something like that. This secretary, it makes like a distribution for these tests in a lot of the public hospitals in the country, and you have a limited number of tests, of serological tests in all these hospitals. So it's not the ideal world, but it's the reality here in Mexico. For example, we have the antibodies against the hepatitis A virus and anti-HEV. Anti-HEV, we have two examples, like anti-HEV IgM. That indicates an accurate infection by the hepatitis A virus, and the other is anti-HEV IgG, indicates a past infection or immunization against the hepatitis A virus. If we see, it's from the same hepatitis virus, from the same thing, but it's different focuses from the proof. It's not the same. I think it's not the same view. Okay. All the example we have the antibodies and antigens of the hepatitis B virus. They have 4 types of proof of serological proofs. We have hepatitis B surface antigen. That proof indicates an activated infection by the hepatitis B virus. The next is antibody against hepatitis B surface antigen. That indicates recruitment and immunity against the hepatitis B virus or immunization. And next is antibody against hepatitis B CAR antigen, can indicate a past of chronic infection by the hepatitis B virus. And the last one is IgM anti-HBC, indicates an accurate infection by the hepatitis B virus. This type of hepatitis B, they have more serological exams, but it's most common here in Mexico. We have found more hepatitis E and hepatitis B. Well, the next one is the molecular test or PCR. The molecular test detects the genetic material of the virus in blood, providing information about the viral load on the presence of an active infection. It's a very simple text. It's the most easy form to resume the molecular test or PCR. But if we try, if we try to add something more, we can say the PCR allows for the identification of active infections and quantification of the viral load, which is vital for monitoring the progression of the disease and the response to treatment. It's this text is the best way I see when I try to resume the molecular test, the most easiest form. For example, in molecular tests, we have the detection of hepatitis C with virus RNA and HCV RNA, sorry. We have two, quantitative HCV RNA PCR or qualitative HCV RNA PCR. Then the number one measures the amount of hepatitis A virus RNA in the blood, which is crucial for monitoring the response to the treatment. Oh, sorry, wait, I stay this one, but. And the qualitative HCV RNA PCR detects the presence of hepatitis A virus RNA, confirming an active infection. And the difference is in one of these, it's an hepatitis C active infection in that moment, but the other one is amount if the blood, which is crucial monitoring the response to the treatment. It's you can see all the treatment in your patient with hepatitis. It's how the body and the blood is responded to the treatment. It's the different focus for on the same proof and the same hepatitis type, but it's different focus line of the proofs of the test. Other example, we have detection of hepatitis B virus DNA, HBV DNA. We have said then again to test. The first one is quantitative HBV DNA PCR. That one measures the amount of hepatitis B virus DNA in the blood, essential for evaluating the viral load and the effectiveness of the treatment. And the qualitative HBV DNA PCR detects the presence of hepatitis B virus DNA, confirming an active infection. The qualitative, if you see in the hepatitis C and the hepatitis B, the qualitative HBV DNA have one function, and it's see the active infection of the hepatitis B and hepatitis C. It's in hepatitis C is active infection, and hepatitis B it's active infection. Qualitative HBV DNA PCR, it's the focus for the half of the proposite. If we in quantitative HBV DNA PCR and the hepatitis B or hepatitis C, it's more specific to the treatment in the two of types of hepatitis. It's must see the treatment responses. All example is the detection of hepatitis E virus RNA, HEV RNA. It's qualitative HEV RNA PCR detects the presence of hepatitis E virus RNA, confirming an active infection. We have that's example of hepatitis E. And in Mexico, this is the most common test we can find in the hospital, in the public hospitals, because it's the most common type of hepatitis we have here in Mexico. The importance, it's very important. These examples of serological and molecular tests are fundamental for diagnosis, monitoring, and management of hepatitis infection, helping healthcare professionals provide appropriate treatment and prevent the spread of these viruses. If we remember in the different types of the proofs, like a quantitative and qualitative in molecular, or if you go back for is serological, we have anti-HEV in the HEV and different points. This different type of test give us like a medical, like a doctors or like a medical students, different way to see and attack the hepatitis. Like it's very expensive and complicated treatment, and more complicated to be and combat this problem. Sorry. Well, in the same time, the importance of early detection is fundamental for all the world, all the countries. Early detection of hepatitis allows for timely treatment, which can prevent progression of cirrhosis, liver cancer, and other severe complications additionally, or facilitates the implementation of measures to prevent the transmission of the virus to others. Here in Mexico, we have a class when you're a university student. We have a class like a medicina preventiva, medical prevention. It's this is a very important class because in that class, the doctors teach you like the medical focus, the prevention focus. It's the best form to try or make it medicine on save the life. A lot of diseases in the world, it's prevention. The prevention, it's the most important form and the most powerful form to teach all the countries, to teach all the people like how to combat the diseases. So it's the important early detection, like this in this paragraph say, allows for timely treatment, which can prevent progression of cirrhosis, liver cancer, and other severe complications. Timely treatment. We know the time for diagnosis, the different diseases is not only for hepatitis. It's very important to combat and win the diseases, and hepatitis is not it's not another way. It's the rule. The time for diagnostic is very important to the treatment successfully. Benefits of early diagnosis. We have a lot of benefits of early diagnosis, but I'm trying to resume in principal three. We have more. We have a long list from benefits for early diagnosis, but I'm trying to resume in three. First one is early treatment. Improves treatment outcomes and reduces the risk of long-term complications. It's simple. It's too easy to see. And prevention of transmissions enables the implementation of preventive measures to avoid the spread of the virus. And the other one is effective monitoring and management. That one helps healthcare professionals monitor the progression of the disease and adjust treatment as necessary. It's simple. These three most important, and I don't raise the importance for the other ones. All the benefits, it's important, but in this part, I put this early treatment, prevention of transmission, effective monitoring and management, because it's most focused for the diagnosis and the proofs and the test. So this is the three most important benefits on early diagnosis. We have a lot of more one. Well, challenge in low resources settings. That is very interesting thing in when I study for this explication of this speak. I found a lot of challenges in a lot of countries in all the continents. So I put four. I read and I say, okay, that is so important when I say limited access to diagnosis tests, serological and molecular tests can be expensive and are not always available. Here in Mexico, I use Mexico here. For example, when I say in the beginning of the speak, Mexico, the serological test is not, and the molecular test is not for all the people. It's not for all the parts of Mexico. We have a very limited number of tests in a public case. When I talk, and when we talk from private, we don't have a limited test, but it's so expensive, and not the people in Mexico they can pay. Lack of infrastructure, the absence of well-equipped laboratories can make it difficult to perform accurate tests. The infrastructure is very important to make a correct test, correct results, and different things and points of view. Other way in Mexico, we have a lot of laboratories. The most number of them it's private laboratories, but the public laboratories they have a very good infrastructure. A little bit it's less number from public laboratories, but we have public laboratories. The third one is education and awareness. Lack of knowledge about hepatitis can lead to low rates of detection and treatment. In this point, we're back to the thing I say before. It's like preventive medicine is the best way to combat this disease and other diseases. Preventive medicine it's the best way to teach the persons, all the countries, to protect themselves for all the diseases, all the public diseases, and it does better for 30 points. The prevalence for no, I don't know, it's not prevalence world. It for better results or better treatment for the patients are less complicated difficulties after the treatment or chronic problems or something like that. If we have more education and awareness from these diseases, we combat this problem. And the last one, financial resources. Lack of funding can limit the ability of health systems to implement effective detection and treatment programs. So, the problem of the financial resources, it's so easy to see. It's done no always we have the money necessary to make the programs and to make the health carefully is when we want if we like a doctor or something like that. I want to protect my patient in all the ways possible, but sometimes the problems we cannot to protect the patients in a lot of ways, and that is a very, very important thing to combat. So if you don't have any questions, thank you so much for the invitation. I don't see what time is it, but I hope you have my number in the group, and I'm very thankful for the invitation, and I go very fast because it's a lot of information. I'm gonna try to make you a little bit resume. So thank you again for the invitation, and I'm very happy to be here.
Thank you so much, Luis, for your time for expanding on this topic. Talking about that, I would like to call our next speaker, Bara Nassar from IMSA-Palestine. Over to you, Bara.
Hello, everyone. Just I will share my screen. Again, hello, everyone, and welcome to our session. My name is Bara Nassar, a fifth-year medical student from IMSA-Pakistan. Thanks for the organizing committee for this invitation, and I'm glad to work with this great team of speakers. Before proceeding with our session, we will start with an icebreaker. You can scan the QR code or go to Kahoot website and enter the game pin. You can enjoy, guys. Okay, they are joining. Okay, let's wait for a minute. Okay, let's start. Okay, let's go for it. Okay, how many types of viral hepatitis? Okay, Maham. Let's go for the second one. Hepatitis B can be contracted through casual contact, like hugging or sharing utensils. It's fact or myth? Okay, hepatitis B, as other speakers mentioned in the previous part, hepatitis B contracted through sexual contact from mother to her fetus during labor, and through IV route, either unscreened blood transfusion and or sharing needles and other things. Oh, Maham is trying to win. Hepatitis B can only infect those already infected with hepatitis B. Is it fact or myth? Okay. Maham also. Only people who use drugs get hepatitis. It's a fact or myth? Which type of hepatitis is most commonly associated with a chronic infection? Now on the top. Vaccination. Oh. Which hepatitis virus is not typically spread through blood? Yes, A and E. Transmitted through fecal oral. Who's the winner? Oh. Congratulations. Let's come back to our session. Before we go to the most important part about treatment and management, we will go for an overview of the pathophysiology of hepatitis or RNA viruses, except hepatitis B, which is a DNA virus. Hepatitis A virus is not cytopathic in itself. What we mean with cytopathic, it doesn't cause a significant change in the hepatocytes like hepatitis B does. It doesn't interfere with the genome of the human body. And after it enters the cytoplasm, it will get translated and producing polyproteins. These polyproteins gets presented and damage occur by cell-mediated immunity. And it doesn't cause a chronic state. It's almost always causes an acute infection. About the pathophysiology of hepatitis B, it's a DNA virus, and it contains a specific type of enzymes called reverse transcriptase with DNA and RNA dependent function. We will get benefit from this enzyme in the treatment of chronic hepatitis B. In the acute infection, it's somewhat similar to hepatitis A with some differences, is that in hepatitis B, DNA gets integrated in the genome of the host, not like hepatitis A. And the chronic infection in hepatitis B caused by viral resistance due to failing immune clearance.
रात को इतना पेशेंट आउटफ्लो भी नहीं होता, कहते कुछ भी नहीं करना पड़ता, आप खुद सो जाओ जाके, या बस फॉर्मेलिटी 2-3 पेशेंट.
Can we continue?
Yes, please.
Okay. About the pathophysiology of hepatitis C, also hepatitis C is an RNA virus, not cytopathic in itself. And there is no relationship between the viral load and the severity of the prognosis. I got this from Elsevier, from a research conducted in 2023, I think. And the direct pathogenic effect of hepatitis C is hepatic steatosis, which means lipid accumulation in hepatocytes, and we will get benefit from this point in the treatment of hepatitis C, and it's usually cause a chronic state. About the pathophysiology of hepatitis D, it's usually occur in a patient with previously infected with hepatitis B, and it occur as a co-infection or super-infection. And the combination of hepatitis D and hepatitis B is the most severe form of chronic viral hepatitis, according to the WHO, due to more rapid progression toward liver-related death and hepatocellular carcinoma. About the pathophysiology of hepatitis E, it's not well understood, and it assumes that the main sites of replication for this type of virus is the intestinal tract before reaching the liver, and it typically causes an acute state. It's usually self-limited and don't cause a chronic state. After this overview, let's come back to the treatment and management part of our session. Hepatitis A, according to the WHO guidelines, don't require treatment. It's almost always self-limiting, and we should give the patients of this type with supportive measures like fluid replacement, because they lost a lot of fluid from vomiting and diarrhea. And we should avoid unnecessary medications like paracetamol and acetaminophen that will cause liver damage. And hospitalization is unnecessary in this type of patients if there is no signs or symptoms of acute liver failure. About hepatitis B, stage liver disease, or if there is fulminant hepatic failure. In acute infection with hepatitis B, we don't use antiviral medication. We usually use antiviral medication for the chronic state and with specific indications like cirrhosis or advanced fibrosis, acute liver failure, immune active phase, or hepatitis reactivation, co-infection with hepatitis C or HIV, or if there is family history of HCC. Let's go for the treatment regimens. In hepatitis B, we use nucleotide reverse transcriptase inhibitors and nucleoside reverse transcriptase inhibitors, which inhibit the enzymes that's specific for hepatitis B, which I mentioned in the pathophysiology of hepatitis B. A nucleotide reverse transcriptase inhibitor inhibit the reverse transcriptase directly, while nucleoside reverse transcriptase inhibitor inhibit indirectly through it goes to the liver and gets methylated and transformed into the nucleotide reverse transcriptase inhibitor, and then inhibit the reverse transcriptase tenofovir, and the nucleoside reverse transcriptase inhibitor entecavir. And there is another medication which is called pegylated interferon alpha, which we use especially in the case of there's hepatitis D co-infected with hepatitis A, and also in young patients with compensated liver disease. We don't use it in the decompensated liver disease because it will cause exacerbation of that condition, and we use it for 48 weeks. Let's go for hepatitis C treatment. According to the WHO, in every disease, the main goal of treatment is curing from the disease and preventing long-term complications. Antiviral medications that we use in hepatitis C is sofosbuvir and daclitazivir. These drugs work by inhibiting the RNA-dependent RNA polymerase, which produce the RNA negative sense in hepatitis C, though we prevent the replication of hepatitis C through these medications. And treatment, as I say, we usually use treatment only for the chronic hepatitis C. And as I mentioned in the pathophysiology of hepatitis C, the pathophysiology of hepatitis C is making hepatic steatosis. So we will prevent, we will reduce the risk of developing progression of hepatitis C through controlling the risk factors for hepatic steatosis, like avoiding alcohol. As we know, alcohol causes alcoholic hepatic steatosis, and if the patient is overweight, he is at risk of developing what's called metabolic syndrome, which one of its component non-alcoholic hepatic steatosis. And with proper treatment, people with hepatitis C can be cured and live healthy lives. A direct-acting antiviral that we use in hepatitis C is recommended for all adolescents, and children down to the 3 years of age with a chronic hepatitis C. And we use it for a short duration, usually 12 to 24 weeks. Hepatitis B, we use pegylated interferon alpha, usually for 48 weeks, irrespective of the patient response. And there's significant side effects of this medication. We don't use it in decompensated cirrhosis, active psychiatric conditions, and autoimmune diseases because it will exacerbate these conditions. And there is a promising treatment called bulevirtide, which works by blocking the receptor that hepatitis B and hepatitis D enter the hepatocytes through. Let's go for the final type, which is called hepatitis E. Hepatitis E treatment, according to the WHO, is similar to hepatitis A. It's a self-limited viral hepatitis, and it don't require hospitalization unless the patient is a pregnant woman, because pregnant woman with hepatitis E is suspected to causing fulminant hepatitis, so it will require hospitalization. And it's also there's necessary to avoid medications that cause liver damage, that like acetaminophen and paracetamol. Immunocompromised patients with chronic hepatitis E will get benefit from some medications like ribavirin and interferon. Thank you for listening. I wish it will be a good presentation. If there is any questions. Thank you, Maham. Thank you for the invitation, and I'm happy to be with you today. Thank you all. Can we have a photo? Who will take it?
Are you taking the picture?
Yes, I am.
Perfect.
All right then.
Is it done?
Yeah.
Thank you.
Thank you.
On to
Thank
the
you.
next. Thank you so much.
Yeah, thank you so much, Vera, for that amazing presentation. Now, I would like to invite our last speaker, Dr. Christopher Huna, who is the IFMSA Program Coordinator for Communicable Diseases. So please share your presentation. Thank you.
Sorry, Maham, it's Nada's presentation right now.
Okay, sorry. So I would like to invite Nada, and she is IFMSA Public Health Trainer of IFMSA Egypt. So please share your presentation. Thank you.
Okay. Hello everyone. I'm Nada Mahmoud, intern doctor from IFMSA Egypt, and I am IFMSA public health trainer. Now we will talk about hepatitis prevention and control. We will cover essential aspects such as vaccination, public health measures, as safe injection practices, blood screening and safety, education and awareness campaigns. Let's start. We have primary, secondary, and tertiary prevention. Primary prevention through vaccination, screening, safe injection practices, and occupational safety, education and awareness campaigns. Okay. Vaccination is one of the most effective ways to prevent hepatitis. Hepatitis vaccines have been given to millions of people all across the world without any evidence of serious side effects. They are very safe and they are extremely effective. Hepatitis A and B vaccination are widely available and they are recommended for high-risk groups and the general population. Hepatitis A vaccines are typically recommended for children, travelers to areas with high hepatitis A virus rates, and people with chronic liver disease. But hepatitis B vaccine is a safe and effective vaccine that is recommended for all infants at birth and for children up to 18 years. The hepatitis B vaccine is also recommended for adults living with diabetes and those at high risk for infection due to their jobs, lifestyle, living situations, or country of birth. Since everyone is at some risk, all adults should seriously consider getting the hepatitis B vaccine for a lifetime protection against preventable chronic liver disease. Hepatitis B vaccine is also known as first anti-cancer vaccine because it prevents hepatitis B, the leading cause of liver cancer worldwide. What about hepatitis C? Unlike hepatitis A and B, there is currently no vaccine for hepatitis C. However, research is ongoing and several promising candidates are in clinical trials. The best way to prevent the disease is to avoid contact with the virus. Extra care should be used in healthcare setting and for people with a high risk of hepatitis C virus infection. People at risk include those who inject drugs and those living with HIV. And ways to prevent hepatitis C include safe and appropriate use of healthcare injections, safe handling and disposal of needles and medical waste. Also, testing of donated blood for hepatitis C virus and other viruses. Then we will move to public health measures. It's safe injection practices, blood screening and safety, education and awareness campaigns. Let's go on more details. Safe injection practices. We should ensure safe injection practices because it's crucial in preventing the transmission of hepatitis. This includes using sterile needles and syringes and safely dispose medical waste. A safe injection doesn't harm the recipient or expose the healthcare provider to avoidable risks. Blood screening and safety. Screening blood donations for hepatitis viruses is vital. Ensuring that blood transfusions and organ transplants are safe helps prevent the spread of hepatitis. Then, education and awareness campaigns. As public health advocates, it's our role. So, what about you? Can you suggest some methods we can do in awareness campaigns? You can raise your hands and take the floor. In your NMOs and ULCs, what methods do you use to aware about different methods? You can write on the chat box. You can open the mic.
I guess we can hold seminars like these, and we can also go in areas such as rural areas or areas where there's not enough awareness about hepatitis, and tell them about it. We can hold screening camps there, and yeah, and we can ensure that they're following the proper preventative measures to prevent hepatitis.
Okay, that's great. Anyone else have any inputs? Okay, thank you for your inputs. As you said, we can use seminars and other different methods as campaigns in schools, in the places we can find the large number of public as villages or online awareness campaigns. Raising awareness about hepatitis and educating the public on prevention measures can significantly reduce the incidence of new infections. Public health campaigns should focus on promoting vaccination, safe practices, and importance of regular screening. It's very vital. Then, secondary and tertiary prevention. Early diagnosis provides the best opportunity for effective medical support. It also allows those infected to take steps to prevent transmission of the disease to others. Antiviral agents against HBV and HCV, hepatitis B virus and hepatitis C virus exist. Treatment of HBV infection has been shown to reduce the risk of liver cancer and death. It's estimated that from 20 to 30% of persons with HBV infection could benefit from treatment. However, drugs active against HBV aren't widely available or utilized in persons infected with HBV. HCV is generally considered to be a curable disease. Scientific advances and intense research have led to development of many new oral antiviral drugs for HCV infection, as mentioned in the previous part. So let's summarize. The prevention and control of hepatitis involve comprehensive strategies as vaccination, safe practices, and public health measures. And I encourage you all to advocate for hepatitis prevention in your NMOs and your LCs. Get vaccinated if you haven't already. That's it. Thank you. Let me know if you have any questions. Okay, thank you. Okay, that's it.
Thank you so much, Nada, for your time and for the beautiful session. Now I would like to call the next speaker, Dr. C. Haruna, IFMSA Program Coordinator for Communicable Diseases. Over to you, Dr.
All right. Hi, guys. I'm so glad to be here. You're going to forgive the background noise because I'm like outside. So forgive the background noise, but just like give me a thumbs up or just write in the chat box if you can hear me so I know to continue. Namaste. Namaste. All right, perfect. So I'm just going to share my screen right about now. All right. Um, just give me a second. Please just hold on a second. I'm trying to share it now. Okay, I think I have to save it as a PDF before sharing it. So let me just do that now. All right. Good. I believe you all can see my slides. Just let me know if you can, or in the chat box, and then I'll just proceed immediately.
Yes, they are with.
Okay, you can see it, right?
Yeah. And
All right, thank you so much. So one thing a lot of people also do not know about me is the fact that I love history and culture so much. So while we're talking about hepatitis, we're just going to do a quick pop quiz also on like geography. So I hope we are as well-rounded as medical students should be. Once again, I'm Dakas Christopher, and I will be talking about the global aspect of hepatitis. And once again, it's a pleasure to see you all. Sorry, I'm using my phone, so I really can't zoom. I don't know. Okay, let me just go to this slide. Okay. I hope you can still see it though. I'm using my phone, so I can't really zoom it. All right, thank you. So once again, I'm talking about the global aspect of hepatitis. So in this segment of the session, we are going to be looking at some selected countries and how hepatitis has affected their healthcare systems and the initiatives that are carried out to mitigate the spread of hepatitis. Okay, so previous speakers have spoken on various aspects of hepatitis, including the pathophysiology, the prevention strategies, among others. And that's like most of what has been discussed is at the individual level. But you know that a lot of people do not have the power to control their own health. They do not have access to health information. They do not have access to infrastructure. They do not have access to healthcare. And it is the responsibility of constituted governments to make the provisions for these strategies for them. So we are going to be looking at how different countries approach this and how we as medical students too can see the need and avenues to contribute to the fight against hepatitis in local communities. So welcome to the session. We will start. So as a way of introduction, as I've already stated earlier, we are going to be looking at the different strategies for the control of hepatitis in different countries. And firstly, we'll be going to Pakistan. So I'll just ask a quick question. I mean, a lot of us here already a lot of you are from Pakistan. So, but then just a quick question, what region? So the WHO has 6 regions. So what region of the world is Pakistan is according to the WHO classification? So just type in the chat box. and then we would go on. Okay, Asia. Yeah, okay, the Islamic Republic of Pakistan. Yes. So what region of the WHO is the Islamic Republic of Pakistan in? South Asia. Hmm. I need more answers. South Asia, okay. Okay, so we have South Asia, South Asia, South Asia, Eastern Mediterranean. Do we have any other guesses? I will close the quiz in 5, 4, 3, 2, 1. Okay, so thank you all for your responses. Yes, Pakistan is in South Asia, but in the WHO classification of regions, Pakistan is in the Asia Pacific region. Okay, so thank you so much for your responses. So we are going to be talking about the burden of hepatitis in Pakistan. We are going to be looking at initiatives that have been carried out by the Pakistani government and public awareness, the impact of public awareness on Pakistan. Okay, so hepatitis B and C poses a significant public health challenge in Pakistan, and of course, we already know that these are viral infections that primarily affect the liver, leading to severe complications like liver cirrhosis, liver cancer, among others. Now, the prevalence of hepatitis in Pakistan, it is estimated that around 5 to 7% of the Pakistani population is infected with hepatitis B, and approximately 4 to 5% are infected with hepatitis C. And in fact, according to the WHO, hepatitis is like the 8th cause of mortality in Pakistan. Okay, and this causes great impacts on the healthcare system, affecting not just economic situations of families of patients, but also puts a lot of pressure on the healthcare system. Okay, because you would see that because of low economic status, a number of people may not be able to present to the hospital on time, be able to access healthcare, and then we present at and so we present at late stages when the infection has already degenerated to probably liver cirrhosis or liver cancer. And then you will find that there are great costs associated with managing the complications of hepatitis. So an initiative that has been carried out by the Pakistani government includes the Prime Minister's program for hepatitis prevention and control. And also I saw online that there was a Chief Minister's program for hepatitis prevention and control, which revolved around vaccination, screening and diagnosis, treatment access, and public awareness. And the aspects, I noticed that for the Chief Minister's program for hepatitis B and C, it's mostly covered one region, the Sindh region, the Sindh province of Pakistan. So we see that, as has already been discussed, we have that one of the cornerstones of the prevention of hepatitis is vaccination. Okay, especially against hepatitis B, because we see that hepatitis B is the one that you can be vaccinated against. So, and we are to primarily target newborns and high-risk groups. Okay, we also have the establishment of laboratories and research centers to aid with quick diagnosis of hepatitis and to encourage screening for the disease. So providing this infrastructure is one way that Pakistan has been able to contribute to the fight against hepatitis globally. And also we have aspects of treatment access and public awareness. So I'm just going to keep this for now, and then at the end, we'll just come to see areas where all the countries have something in common, and then we'll see how we as medical students can contribute to the fight against hepatitis. So we would also see that public awareness plays a pivotal role in the fight against hepatitis in Pakistan. And the positive impact of health awareness, of public awareness, include having informed communities, okay? We have more informed communities. When we have more informed communities, they'll be able to be aware of their symptoms early, which would help their early presentation to the hospital for them to be able to get quicker treatment, okay? Quicker screening treatments, the diagnosis and treatments. We would also have, with more public awareness, we'll be able to have reduced stigma associated with hepatitis. We'll also be able to record increased screening levels and vaccination levels, and also get behavioral change. These are very key important things for us to note as we look at the impact of public awareness in the fight against hepatitis. Now to the next slide. We will be flying to Malawi. So I would still ask the question. So for this slide, the question I would ask is, Malawi is an African country, okay? So Africa is divided into North, East, West, South, and Central. So where is Malawi in? Okay, so which region will you put Malawi in? I would want to see your responses in the chat box. Is it in North, East, West, South, or Central? I believe you can hear me, okay? Okay. We have someone saying South, okay? Do we have any more responses? South. Thank you, Maham. Thank you, Sylvia. All right. Thank you so much for your responses. You are all correct. Malawi is in the southern region of Africa. So for Malawi, we will be talking about some of the challenges that impede the progress of the fight against hepatitis. And we will be looking at as issues like limited infrastructure, vaccination, and the impact of health education. Okay, so the healthcare infrastructure usually poses significant barriers to effective hepatitis prevention, diagnosis, and treatment. So I would start with saying things like insufficient facilities. In a number of rural areas, we could see that there is an absence of adequate healthcare facilities to be able to cater to the teeming population in those areas. And that would cause a serious issue for people who will be looking for access to healthcare when they show up with some particular symptoms. Okay, we could find this in a lot of low and middle income countries where people, as I said earlier, people could present late when the symptoms have begun to pose an issue for their day-to-day activities. Because if people can go about their normal activities in the day, they would think that they can manage with the symptoms, okay? Because they're also looking at how their families or their personal lives would be economically affected by them traveling several kilometers to find the nearest hospital. So they would usually wait until they can no longer go to work before they would present to the hospital. And this poses a large issue and poses a serious gap in accessing hepatitis care and treatment. You could also have things like resource shortages, both on the aspects of the patients and from the aspects of the government and the healthcare facilities. Because of lack of essential supplies like vaccines, diagnostic tools, and medications, it could really delay the care for people who are looking for care for hepatitis and greatly impact their ability to be able to be catered for when they are infected or they are at risk of infection. You also have workforce challenges. The WHO recommends a doctor to patient ratio of 1 to 600. But you would find that in most low and middle income countries, the reverse is the case. We have lots of patients and very few doctors. In fact, in my country, Nigeria, we have 1 doctor to 10,000 patients. And even with this, it is usually disproportionately, the distribution is not proportionate to the population, because you would find that in one city, you could have more than 1,000 doctors, while in the rest of that region or state, you could have just maybe 10 to 15 doctors looking after the rest of the population. Because besides wanting to provide access to care, we would also need to look at the economic aspect, the pay that is provided for doctors. So usually doctors would prefer to stay in the cities than in the rural areas. And then it poses a great gap for care for people who are at risk of infection or infected with hepatitis. And even for those that, even in the cities, quote unquote, you will find out that the healthcare workforce there is greatly overstretched and overburdened by the amount of cases that they have to see every day. And this reduces the quality of care and limits the reach of hepatitis-related healthcare services. Okay. So, and as I said earlier, we have poor compensation for doctors, and it could really worsen working conditions. We would also look at the aspect of low vaccination rates. As I've hinted earlier, due to low resources, you would find out that people are not access vaccinations for hepatitis, and it is a problem. And even when vaccines are available, there is also an issue with vaccine hesitancy. And this brings in the importance of our role as medical students to flood the media, both mass media and social media, with correct information regarding hepatitis. Because when people are only consume anti-vaccine messages, you could find on social media messages like vaccines make people infertile. You could find messages like vaccines are out for population control, so they are trying to kill people because of the vaccines. It makes people more hesitant to receive vaccines for hepatitis, and this poses a problem from both religious and cultural beliefs. So this is also a problem. You could also have resource constraints, because sometimes vaccines may need to be paid for, especially when they are not subsidized by the government and the healthcare systems. So we could also look at we would also be looking at the aspect of health education. There is a limited reach for health education campaigns, especially among rural areas, people with no access to the internet or without access to proper healthcare information channels. It could pose a problem, okay? And there could also be imbalance in resource allocation, which could pose a significant issue when you are looking at access to healthcare, okay? And the challenges faced by hepatitis warriors in Malawi. Next, we'll be looking at Serbia. So for Serbia, we would see that there is a big issue regarding awareness, stigma, and screening. But luckily, in Serbia, we would also be looking at their national hepatitis strategy, which is something that we implemented to help them to fight those challenges in the fight against hepatitis. So for Serbia, when we come to talk about awareness, there is a limited public knowledge about hepatitis in the general public. You know, personally, when I sit down and look at it, a lot of people, apart from medical students who, like, it's kind of like their lives to study diseases, people have a lot of things going on for them, and they could care less to know about the pathophysiology of different diseases. So it is important that they have at least basic knowledge about, like, the kind of diseases that this is, how it can be transmitted, and how they can prevent or protect themselves from it. Because when they have this awareness, it greatly reduces stigma, as we've discussed earlier. So as I said, in Serbia, a lot of people could lack basic knowledge about hepatitis, mode of transmission, and the importance of vaccination. And this could lead to late diagnosis and a higher rate of transmission. At this point, I would want to note that we've done a good job. I mean, the world has done a good job with regarding HIV. That we have things like people knowing about PrEP, pre-exposure prophylaxis, and post-exposure prophylaxis, PEP. But a lot of people think that once they take PrEP, they are safe from all other STIs. But that's not true. Okay? You still have to protect yourself from other STIs. And this brings into mention hepatitis. We do not have PrEP for hepatitis. So proper sexual behavior is also very important. And a lot of people do not know this. And they also do not know that hepatitis B is even far more infectious than HIV. And this awareness is very important, especially for us medical students when we are looking at our impact in. There are also insufficient campaigns aimed at educating the population about hepatitis. And as such, more comprehensive and continuous education efforts are needed to inform the public and promote preventive measures. I've already spoken about stigma. Now, about the national hepatitis strategy, there are a number of gaps or challenges that hinder the effectiveness of the national hepatitis strategy. Things like resource allocation and coordination and collaboration. These are very important. Now, even for us medical students, we would want to place a big emphasis on collaboration between our organizations and the government and other stakeholders to try to ensure that our reach is more effective. I'll give an example. 2 years ago, we coordinated a hepatitis activity in my local community in a market to carry out testing for hepatitis.